exactly is nurse burnout, and why has it become such a common topic for healthcare professionals? Imagine going to a hospital or a facility only to be cared for by a healthcare professional, one that is mentally drained, emotionally overwhelmed, and physically exhausted. A large percentage of nurses who are reporting this burnout are making it the biggest challenge in healthcare. A nurse may care for dozens of patients during a single shift. They skip meals, miss breaks, or barely have a break due to work overload, but they are expected to provide a safe, compassionate care. For many nurses, this is their everyday reality. But at what point does it become safe for patient safety that our most essential workers are burnt out due to ample reasoning? Nurse burnout is only an individual challenge, but also a sociological issue shaped by workplace demands, organizational structures, and healthcare system pressures that can affect both healthcare workers and patient outcome and care being provided. As someone who's been in the healthcare field for 9 years, I have decided to move forward with chasing bigger dreams and credentials. I did my research on healthcare burnout. It's becoming more understandable as to why it's happening. I'm going to discuss how sociological issues shape workplace demands, organizational structures, and healthcare workers and patients' outcoming care being provided. Understanding what burnout is only part of the picture. Now we need to better understand why it happens in the workplace, social factors that influence daily experiences. For this topic, sociological issues shaping workplace demands. Most places are experiencing staffing shortages, as we all know. That's common anywhere. Healthcare facilities and hospitals are experiencing nursing shortages. While the career itself is very extensive and learning process is definitely there, it can be an increased workload for nurses on any duty or shift. In my experience, I've seen some places scramble to find coverage during shifts. Nurses may care for more patients at one time. They are also required to split their time and attention with multiple responsibilities. When there is a staffing shortage, patients are cared for in a rush, and that's not safe. This leaves nurses to respond differently with how they may feel, act, or even care for someone and themselves. There's long working hours and shift schedules that may not meet demands. Most nurses are working 12 hours overnights, weekends, and even holidays, missing a lot of time between a work-life balance. Some are even working extended hours beyond their set shifts. This is proven to increase physical and mental fatigue. Shift work can affect sleep patterns as well, which leads other problems in a work-life balance that just may not be susceptible to take on. This can include workplace organizations. Nurses have to balance direct patient care with things like charting properly, administering the right medications accurately, and other tasks that include precise decision making. When things within the workplace start occurring, this makes it hard for staff and for patients. Sociologists examine how workplace structures influences employees' daily experience. Now that we have discussed what contributes to a healthcare burnout, let's look at the context for examining how it can impact the delivery for healthcare. A big one is communication and teamwork. Nurses communicate between patients, each other, providers, family members very frequently. Having the feeling of burnout in your career can cause disassociation and reduce communication with healthcare teams. Effective communication and teamwork is an important part of coordinating patient care. There also falls into the line of quality of care. As we discussed, nurses are responsible for monitoring patients, document changes, administering medications accurately, and even educating the patients on their care. Burnout in your career has been linked in research to decreased job satisfaction and increased staff turnover. I have personally seen this over the 9 years in healthcare. I remember vividly one day during one of my job placements within a nursing home, the staffing was bad. This caused quality of care to the patients to decrease. I know I worked a solid 14 hours in one day. That's just to make sure each resident was cared for properly. Even some of them were administrators were on the floor assisting the best way they could. And honestly, they looked lost. They did not know what was going on behind the scenes because they're in a different aspect of the healthcare organizations. This also leads to workforce stability. Most healthcare organizations may spend additional time and resources recruiting and training new nurses. Burnout can be associated with higher rates of absenteeing and nurses leaving the profession altogether, which we don't want. What we call the seasoned nurses leave the baby nurses, and it hurts the whole team. Me, as coming in as a baby nurse, I need the seasoned nurses. These are the things that they may know better that we could do and that they could teach us so that we could be more proficient and accurate in our work. I feel like if some healthcare organizations could focus on new ways or policies within the organization, the burnout may even decrease. Researchers have studied workforce stability because it influences functioning of the healthcare system. Now that we have explored workplace and social factors associated with nurse burnout, let's examine how burnout can influence the delivery of healthcare. The first one being patient education and health literacy. Burnout may influence the amount of time and energy available for patients' education, which is very important. As a nurse, you may be able to explain the care that they are needing beyond the nurses for themselves. Being educated as a nurse is a huge responsibility. Researchers study patient education because it is an important part of helping patients understand and manage their health. Another big one, clinical decision making. Having burnout in healthcare field has been associated with cognitive fatigue. Research studied this because it may affect attention to details, concentration, and decision making, which is a key factor as a nurse. We need to make sure that we are paying attention to every little detail, every little change that may even occur. Nurses make a ton of clinical decisions throughout each shift, as I have stated before, and that alone are big responsibilities. Another one being healthcare efficiency. Burnout is studied for its relationship to workflow, productivity, and the coordination of care. This can show how our workplace stress can affect the effectiveness of healthcare teams and the organizational process. When healthcare efficiency starts to decline, this can help explain why burnout is viewed as both individual and organizational issues. In conclusion, from the sociological perspective, nurse burnout can be understood through its workplace conditions and its effects on healthcare delivery. As I stated, nurse burnout is not only an individual challenge, but also a sociological issue shaped by workplace demands, organizational structures, and healthcare systems pressures that can affect both healthcare workers and patients' outcome in the care being provided. We discussed sociological issues shaping workplace demands, nurse burnout on delivery of care, and healthcare efficiency. Understanding nurse burnout helps connect individual experiences with larger healthcare systems and the social structures that influence them. Keep in mind, burnout in the healthcare for nurses is widely studied. It also reflects a broader workplace and system patterns.